Varicose veins are treated with a multimodality of methods. The first thing that's really important to treat varicose veins is to have a proper diagnosis, to have a proper ultrasound, so you know exactly why someone has varicose veins and what is causing the varicose veins. It's not exactly the same thing in everybody, but in most people it has to do with what's called venous insufficiency of the superficial veins in the leg. And by superficial, I don't mean veins you can see, I mean veins that are just under the skin that you usually can't see. And when you treat the veins that you can't see, that are maybe half an inch or 3/4 of an inch under the skin, it makes it possible to make the varicose veins go away, because you're turning off the faucet that feeds the varicose veins. And then once that faucet is turned off, you can attack the varicose veins directly. They will either get smaller with the first procedures you did, or you can inject them or remove them so that the patient no longer has any varicose veins when the treatment is done, and their legs will feel better as well.